to you with a shortness of breath. Patient comes to you with a decreased inner sound, and we expect it was a pneumonia, so that we have given the levofloxacin for the pneumonia into the elderly patient. And after a week or so, patient comes with the same symptoms. That means it didn't work. That means it wasn't a pneumonia. Now we have to consider alternate diagnosis. So on examination, we have got decreased in a breath. So we went for the X-ray. We found unilateral lymphadenopathy, the Hilar. Number one thing, decrease in a sound skin thing. We found effusion, and we found lower lobe consolidation. These are four things, and the patient has a history of nursing home. This is the fifth clue which we suspect that it could be a TB. It is a primary TB since it is in lower lobe. If it was the secondary, it must have been into the upper lobe. So for the TB, we are going to look this because in both of this, we have a bilateral lymphadenopathy, be it like a lymphoma or the sarcoidosis. And the water infection, we don't have these symptoms. We have like Pulmonary and stuff like that. But in TB, we can have a unilateral lymphadenopathy, we can have the cavitation, we can have the consolidation, we can have the effusion, we get the history of CKD or like immunocompromised or like the HIV or a nursing home or blah 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 blah. So yeah.